Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna go over how to stop or relieve shin splint pain or medial tibial stress syndrome pain. But before I do that, I'm gonna go over the symptoms, the causes, the risk factors, and then we'll go over the steps you can take at home to stop or relieve your shin splint pain. So what are the symptoms of shin splint pain? You might experience some dull, sharp, aching pain, and usually in the inside part of the tibia. So this is the tibia bone. This is the outside of your foot or leg. Your foot is here. So you might experience dull, aching pain, and usually from the inside of the tibia. So this is the tibia bone. Dull, aching pain. The pain increase usually with activity and decrease with rest. And when you palpate, touch those areas, you might experience like some tenderness, soreness to touch. As you can see it here in this image, the medial side of the tibia or the inside of your tibia. So here's your knee, here's your foot, the outside and in here. And usually this is a location that's where you usually experience the shin splint pain. And you can see it in this image too, the muscles here around it, and the pain usually around this area. So what are the causes and risk factors for shin splint? One of the common causes is wearing a bad shoes. So if you wear a bad shoes like high heel or not supportive shoes, that could increase your risk for having shin splint. The other factor is bad gait pattern, which means that you're not walking the proper way of walking. And I have a video on how to walk properly in my YouTube channel. The other common issue is pronated foot or supination, excessive pronation or excessive supination. You can see here in this image, this is a neutral position for your calcaneus. So you should have your feet like aligned like this when you look in the back. But when you have pronated foot, your feet is collapsed inward, and you can see the angle is increasing here in this image. And if you have supinated foot, you will have it collapse outward. So that is actually very common risk factors, because this alignment issue causes a lot of stress in the front and cause micro tear when especially you walk or run on uneven surfaces. You start to build a scar tissue, inflammation, and cause the shin splint. So when you look in the model here, this is the outside of your foot. So this is the inside. So your tibia and calcaneus should be kind of aligned like a straight line if we draw it here. So when you have pronated foot, that means your arch in here is collapsing. So your foot, it's not very flexible to show it here to you, but your arch is collapsing, and that will cause a stress in the front of your leg. And also, if you have supinated foot, which is the arch excessively supinated, and that also causes stress in this area in the front, in the medial part of the tibia, which cause micro tear in the muscles, inflammation, scarring, and that will cause the shin splint pain. So how to treat the root cause of shin splint pain? In order to answer this question, we need to understand normal healing cycle. So it will make sense how to get to the root cause of the problem and stop the pain. So I'm gonna use external paper cut for visualization, but the same process happen internally with the shin splint, but we don't see it because the skin covered it. So when you have any injury, the first stage of healing is inflammation. You can see it in the first image here. You start to have redness and swelling, the blood starts to rush to that area, and you start to experience pain. Second stage of healing is called proliferation stage. That's when your body starts to build a scar tissue. During this stage, there is actually a cascade of events: scar tissue, fascia restrictions, muscle spasm, and trigger point. Perfect scenario during the maturation stage your body should get rid of everything: the scar tissue, the fascial restrictions, the muscle spasm, and the inflammation. That could take days, weeks, months, or years. As we get older, the time of this process decreases significantly. So for chronic condition, when you have shin splint, um, you start to have a micro tear due to either poor body mechanic, the way you're walking, or poor anatomy, pronation or supination of your foot, or you might be running on uneven surfaces with not having a good support for your foot. You start to have a micro tear here in this area. When that happens, your body starts to build the scar tissue, because the scar tissue is part of healing. If your body does not build the scar tissue, if you have a cut, that's going to be permanent damage and it will not close. So we need a scar tissue. The problem is when we have excessive scar tissue, that's in the way of everything and also limit the range of motion, because our muscle should act like a rubber band. When contract and relax, should stretch like this. So when you have a scar tissue, it's like you have a knot in a rubber band. So when your muscle contract, will not stretch much, and that's actually what causes shin splint pain. A lot of micro tear happen here in the muscle. You start to have swelling and decreased range of motion and limited your range of motion here. That's why you will experience pain more with the activity and decrease pain with rest. So if you have this condition for a very long time and you have not addressed it, you're probably going back and forth between inflammation stage and proliferation stage. So the treatment, actually, we have to break this vicious cycle to actually relieve and stop the shin splint. So internally, you can see it in this image for the muscle. When it's normal, there is no, like, the tissue look like nice and smooth here, like the first image. When you start to have micro tear in the muscle, you start to have like this kind of like random tears that's happened from a strain. And when your body starts to build the scar tissue, it builds it randomly. The problem is when you have excessive scar tissue. And I want you to start to palpate now. Touch that area that you have pain in. So you might experience like swelling compared to the opposite side. Also, you might notice some nodes or hardening in the tissue, and that's usually excessive scar tissue, and that's all in the way of the muscle contraction and limited the range of motion of the muscle on the joint. So before I go over the proper treatment for shin splint, I'm gonna go over common treatments that have been used that are not effective based on the studies. So you don't have to waste your time on it. So the first thing that commonly use ice and heat and electric stimulation, and based on the studies, they provide a temporary pain relief. If you're lucky, you might experience pain relief for half an hour. But when you start to look at the normal healing cycle, steam and ice and heat will not do much to inflammation or proliferation. It's just masking the symptoms. The other things that commonly use massage and foam roller. And think about this way: if you have inflamed area and you start to rub over it, you're gonna inflame it more. It's actually gonna make it more worse. And if you inflame it more, you might cause more micro tear, and that will cause more scar tissue and actually could have a negative effect by making the symptoms worse. And when I'm going to go over the fascia system and the anatomy of the scar tissue, it will make a lot of sense why foam roller and massage are not effective to treat deep adhesion, deep scar tissue, because mechanically impossible to go deep with the knuckle when you do massage, or your hand, or the foam roller that works superficially. But studies shows that foam roller and massage either provide short-term pain reduction or no pain reduction. So there is not much evidence support the efficacy of foam roller and massage to begin with. The other thing that's commonly used is stretching. And I personally don't recommend stretching for my patient, because think about this way: you have a micro tear in the muscle and you continue stretching. What's gonna happen is that micro tear gonna be a major tear and make it worse. And actually, based on the studies, stretching actually could cause more inflammation, so it could cause more scar tissue. I personally don't recommend stretching to my patient. There's other alternative safe option than stretching. One of the other things that commonly used by healthcare providers like physical therapist, chiropractor, occupational therapist, joint mobilization. And when we look at the normal healing cycle here, if you move the joint, that's not going to do much to inflammation and proliferation. That's totally like working something different. And based on the studies, joint mobilization or adjustment, it either provides short-term pain reduction or no pain reduction. Lastly, what commonly used is strengthening exercises. We want to do strengthening exercises, but if you do it in the wrong stage while you have inflammation, you're going to inflame it more. But when we start to look at the normal healing cycle, strengthening exercise, it's not going to decrease the inflammation. It's not gonna break down the scar tissue, fascial restriction, muscle spasm. Actually, if you do strengthening exercises while you have severe inflammation, it's gonna inflame it more. What I personally prefer is to do something called function training, because if you do ankle pumps or other stretching exercises, that's not addressing the problem, which is you not walking correctly, or you have pronated foot or supinated foot that causing the issue. So we need to get to the root cause of the problem, correcting your arch, walk the proper way, and then start do function training, which I like to do is teach the patient how to walk the right way, so decrease the risk or eliminate the trigger that causing the shin splint to begin with. So how to get to the root cause of the problem? We have to break this vicious cycle from both ends. So personally, for inflammation, what I do is, patient, if you experience shin splint and if it's an acute stage, usually when you take a break 3, 5 days or 7 days from like running or doing the activity that aggravated, mild cases should be resolved by that time. If it has not been resolved, you're probably going back and forth between inflammation and proliferation stage. So what I personally use for the inflammation, I use the MagnaHeal 2. This is very strong magnetic device that actually the magnetic range around 3 inches from the magnet itself. And that's what I use it for inflammation. If you have mild to moderate inflammation, that works very well to decrease the internal inflammation. If you have severe inflammation and your body is not healing very fast, I would personally like to put all my patients on anti-inflammatory diet, because there is certain food that cause actually internal inflammation and slow down the healing process. For severe cases that the body is not healing very well, you might experience vitamins, mineral deficiency. One of the way you can do right now, actually take advantage of Ask ASTR. It's a free online medical evaluation. The software will guide you through the process of you might have a possible vitamins or mineral deficiency. So it takes about 5 minutes and it's free. While we are working on the inflammation stage, we have to work on the proliferation stage. So we need to break the scar tissue, fascial restriction, and muscle spasm. So what I personally use is the A3, this to break superficial scar tissue, and then I use A5 to release deep adhesion, fascial restriction trigger point. And that's what I said, massage and foam roller are not effective because it's impossible mechanically to go deep enough to cause deep release for the scar tissue and the fascial restrictions. It's, with the A5, we can go like 2.5 inches to 3 inches deep to really do deep adhesion release. The other thing that's overlooked by healthcare providers, that fascial restriction could cause a lot of pain for shin splint. And you can see in this image, the white tissue here is the fascia layer. So we have a fascia layer, superficial fascia layer wrapping the entire body. And when you go buy a meat next time, look at the white filament, and that's actually the fascia layer. So we have a layer that's wrapping the entire body, that's a superficial layer. Then we have a layer that's wrapping a group of muscle, and another layer wrapping each individual muscle. To make things more complicated, but don't worry, the treatment very simple, the fascia system consists of 2 major categories, superficial layer and deep layer. And the deep layer is actually divided to 4 subcategories. As you see here, the operatic fascia, epimycin, premiycin, and endomycin. To make things more complicated, each of these layers consists of 2 to 3 sublayers on the top of each other. So when you have fascia restriction, it's like you're wearing a t-shirt too tight, or you feel like the tissue it's compressed on. And that's why I said massage is not effective in foam roller, because it's impossible mechanically with the finger or the foam roller to go deep enough to release those adhesion and those fascia layers. And if you cannot apply mechanical force on the tight area or restricted area, it's impossible to release it. So we have to have internal mechanical force to release it. So you can see here the epimycin is the layer that's wrapping the muscle. And then we have the premiycin wrapping a group of bundle of muscles fiber here. And then the endomycin wrapping each individual muscle fiber. So we have to release all of these adhesion in those areas, because when you have shin splint, that scar tissue is like gluing all these layers together with the muscle fiber. So you cannot pick and choose which layer to release and expect a good outcome. We have to release the whole fascia system. And people do not realize that also part of contributing to the problem is tight calf muscles and hamstring in the back. So the calf in the back of your leg, the hamstring in the back, the muscle in the back of your thigh. So we need to release all of that, because that tightness force between the front and the back cause stress on the front and cause inflammation and microtear in the front. So we have to clear up the back and the front at the same time. So what I personally use to release the fascia layer, I use the E1 to release the superficial apparetic fascia, and I use the E5 to release the epimycin, premiycin, endomycin. So to sum it up, what should you do when you have shin splint? If you have minor issue, just resting for a week should be good enough to really get you back to normal. But if your issue is consistent, that's indicative of you having a lot of inflammation, a lot of proliferation issues. We need to break that vicious cycle from both ends. While we're doing that, we have to correct your gait, the way you're walking. You have to wear the proper shoes, the supportive. So I will avoid any high heels or unsupportive shoes. And I have videos on how to choose the right shoes. The other thing we have to correct is your arch. If you have excessive pronation or supination, we need to correct that, because that's one of the risk factors. And correct the way you walk. So we usually like to walk heel-toe walking, and I have other video on how to walk properly and correct your gait pattern. After this correction, while we're working on breaking the inflammation and proliferation, things should loosen up and get back to normal. And that's conclude how to treat shin splint pain. If you have any question, leave it in the comment section below, and I will answer it in the future videos. I will see you soon. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below, or go to asterinstitute.com.